Hello everyone, very good morning. So we were discussing your community health nursing unit 1. So we have seen determinants, we have seen what are the health indicator, we have seen what is the concept and we have seen the definitions. And in this class, I would like to discuss you regarding the history and development of this community health nursing and its present concept. So coming to the history, if you see in the early Vedic period, that is in the 3000 BC. So India, it is noted for its ancient civilization. So we have Indus Valley civilization, and in this Indus Valley civilization, it shows the planet cities with drainage system, with houses, and we can also see the public toilets. So here they are having this Indus Valley civilization. They are having these public baths where they have built them with the bricks which were baked with mud. And here, if you see the Asian civilization, by seeing all these things, by seeing the Indus Valley civilization, we can know that these people they are clearly aware of the environmental sanitation. Why? Because they are having proper drainage system, they are having proper housing system, and even these guys are having the public bath system. So that's what you can say, these are the persons who had maintained the proper environmental sanitization in the Vedic period itself. And if you come to the 1400 BC, so during this period, Ayurveda and Siddha systems were introduced. So here, these Ayurveda and Siddha system of medicines, they came into existence. And in this period, the Manu Samhita, they have prescribed the rules and regulations of personal health, and they are the persons who have started the dietetics as well as the hygiene. So we have to nowadays, if you are following the hygiene rituals, see, you can see, you will follow when a person has died, you will follow some hygiene rituals, and at the same time during the birth also we are following some kind of hygiene rituals. So these things were introduced, these things were mainly given to us by this Manu Samhita. And here they are emphasizing that here a person is said to be healthy whenever he is physically, mentally, spiritually healthy in all his aspects of life. So here the definition, if you see the World Health definition, what is there in the definition, the same thing you can observe in this Manu Samhita period. And if you see here, we have a slogan called Sarve Jana Sukhino Bhavantu. So it is nothing but may all the men be free from the disease and may all be healthy. So the slogan Sarve Jana Sukhino Bhavantu, it was an ancient saying which is said by the Indian sages. So here, if you see the history, India, it has a great history. If you go to the back, so here firstly the medicine, they will say that the first medicine was introduced in the country India itself. So here we even have the proofs such as Indus Valley civilization. Coming to the past Vedic period, so if you see the past Vedic period, this is from 600 BC to 600 AD. So during this period, the medical education was introduced in the Asian universities. So what are these Asian universities? Means we have Taxila and also we have Nalanda. So here a hospital system was developed during the reign of Rahula Sanskritya. So he is the son of Buddha. So they have developed the hospital system. So mainly for the men, for women as well as animals, and this was continued to expand, and it has been expanded by the King Ashoka. So the first hospital during the Asian period, it was mainly introduced. It was mainly introduced during the reign of Rahula Sankirtyana. So who is he? He is the son of Buddha. So and later on, the hospital system, it was continued and it was expanded by the King Ashoka. And coming to the Mughal period, if you see the Mughal period, it is from 650 to 1850 AD. So here the Muslim rulers, so they were introduced into the India. So mainly after the 1000 AD. So here we have this Arabic system of medicine, and this Arabic system of medicine, it is popularly known as Unani system. And when they have seen the origin, it was traced to be the Greek medicine. So mainly the Unani medicine, the origin is from Greek medicine, and it was introduced to India by the Muslim rulers mainly in the period of 1000 AD. So it was the popularly known as Unani system. It was the popular known medicine system in the Arabic system. Coming to the Unani system, so it became an integral part of medicine when they have introduced it. Coming to the public health in the British India, so if you see the British India means when the Britishers has came to the India for their ruling. When they have come in the middle of 18th century, and the British ruling, it has lasted till 1947. So they started to establish their military services as well as civil services in the year 1755, and they have also established their rule in the India in the year 1755. In the year 1825, the Quarantine Act was promulgated. And coming to the 1859, here a royal commission, it was mainly appointed mainly to investigate the causes of extremely unsatisfactory condition of the health in the British army who were stationed in India. So during this period in the year 1859, what happened? There were a lot of health issues for the people who are coming from British and who are working in India. They have experienced a lot of unsatisfactory conditions which were related to health. So in order to investigate what is the cause, what they have done, they have kept a commission which is called as Royal Commission. When it has occurred in the year 1859. And if you see the year 1864, here sanitary commissioners were appointed. So where they were appointed means they have been appointed in three major provinces. So they were appointed in Bombay, Madras, and Bengal. And the civil surgeons or the district medical officers, they have become ex-official district health officers. And if you see the year 1869, here a public health commissioner and a statistical officer were appointed with the government of India. And in the year 1873, mainly the Birth and the Death Registration Act was promulgated. So here, in which year the Birth and Death Registration Acts were occurred? They came in the year mainly 1873. And in 1880, the Vaccination Act was passed because of the communicable diseases or the other types of diseases that are coming to the patients, or the public or the people who are living in the community. They have passed a Vaccination Act. That this act was mainly focusing on vaccination to each and every person. And if you see the year 1881, this is the year in which the first Indian Factories Act was passed, and first all Indian census was taken. And in the year 1885, Local Self Government Act was passed. So during this period, these local bodies, they came into existence. And in the year 1888, the government of India, it has directed that sanitation, it should be looked after all local bodies. So mainly when they have introduced the local bodies in the year 1885, and in the year 1888, the local bodies which were formed, they have to look the sanitation. But what happened? No, the persons who are there in these local bodies, they haven't created to carry out this task. Means they were not ready to do this task, and they haven't done. And in the year 1896, so there is a dangerous disease outbreak which is called as plague. Now we are suffering from COVID-19. In the same way, they also have suffered from the dangerous disease which is called as plague, due to which so many people have died. So during that time, as of now, how our governments are becoming alert to mainly save the lives of the people. During those days also, the government, they became very aware, and they have seen the need to improve the public health. And because of this reason, they have appointed a commission which is called as Plague Commission, to mainly look after the plague. In which year the plague has been erupted means in the year 1896. And in the year 1897, another act was promulgated which is called as Epidemic Disease Act, mainly to keep focus. So there were a lot of epidemics that were coming during those times. So, and they have learned a great lesson from the disease plague. As of now, how we are learning from the COVID-19, they have also seen the dangerous disease which is called as plague, and they have learned there. So what they have thought, they have created an Epidemic Disease Act which is mainly focusing on the public health. If there is any outbreak, or if there are any such kind of symptoms, the ANM or GNM or the particular health person, they have to report to the higher authorities. And in the year 1904, they have the Plague Commission, it has reported and it has recommended that public health department should be recognized, and there is definite need for the expandment, and there is definite need for laboratory facilities. And they have also established the purposes of research and production in the area of sera and vaccine. So in which year? In 1904, the plague commission, it has said what is the need for the public health departments, what is the need for expanding the laboratory facilities, what is the need for expanding the research production, what is the need for the increasement in serum as well as vaccines. So they have mainly given the report in these areas. And in the year 1909, the Central Malaria Bureau was established mainly to look after the disease malaria. It was mainly established at Kausali. And in the year 1911, Indian Research Fund Association, it was established mainly to promote the research. So now this Indian Research Fund Association, it has been termed into ICMR, which is called as Indian Council for Medical Research. And in the year 1912, the government of India, it has decided to help the main local bodies. So what it has given means it has given some grants. So it has also actioned the appointment of deputy sanitary commissioners and head officers, so that as the local bodies, they are not willing to do these works, these deputy sanitary commissioners or these health officers, they are responsible mainly to do the sanitary work, and they got the grants from the central government of India in the year 1912. And also if you see here, in the year 1918, so lady reading health school in Delhi was established. And in the year 1918, the nutrition research laboratory mainly at Konur, it was established. So what were established in 1918? Mainly lady reading school, it was established in Delhi. And in Kanur, a research nutritional research laboratory was established. And in the year 1919, so here if you see, the Montagu-Chelmsford constitutional reforms, they led to transfer of public health, sanitation and vital statistics to province under the control of elected minister. So here, this was the first step that was taken in decentralizing the health administration of India. So what they have done, they have created a separate department. So in that department, they are having a elected minister. So here, in the year 1919, the Montagu-Chelmsford constitutional reforms, so they have led mainly the transfer of public health and sanitation and vital statistics to provinces. So this was under the elected minister. And in the year 1920, here municipality and local body broad acts came into existence. So they are containing the legal provisions mainly for the advancement of public health, and it was passed in several provinces. And in the year 1930, All India Institute of Hygiene and Public Health, it was established in the Calcutta. Here the main sources means they got the foundation or they got the help from the Rockefeller Foundation. And Child Marriage Restraint Act, which is also called as Sarada Act, it came into existence. So here in the year 1930, so this was the year they have fixed the marriage age. So the marriage age for girls is like 14 and the marriage age for boys is like 18. So in which year the first marriage act was passed means, here the Child Marriage Restraint Act was passed in the year 1930, which is called as Sharda Act, What is the minimum age? 14 for girls and 18 for boys. And in the year 1931, Maternal and Child Welfare Bureau was established mainly by the Indian Red Cross Society. And in the year 1935, all these were the historical things. So it will be like this only. Try to cope up and try to understand. All health activities in the country, they were grouped under in the year 1935. So central and central come provisional and provincial governmental. So here all the health activities that are carried out in the country, they were categorized into three types. What? Central come provincial and provincial governmental. And in the year 1937, a Central Advisory Board of Health mainly it was set up, and it is having the Public Health Commissioner as a secretary and representative from provinces and as Indian state members mainly to coordinate what are all the health activities that are going in the country. All these things, they will be discussed in this Central Advisory Board of Health. Who are the persons who are there? Public Health Commissioner, he is there as a secretary, and representatives from provinces. So India is nearly having like 28 states and 7 union territories. So the people, the representatives from these provinces, they were there in the board of advisory to health mainly as a member. And in the year 1939, so Madras Public Health Act was passed, and which is the first of its kind in India. So this type of act, for these type of acts, for a particular reason, the act was passed for only the Madras. This was the first thing. And rural health training center were established in Singur, which is situated near the Calcutta. So this one is also started with the aid from Rockefeller Foundation. And if you see this Rockefeller Foundation, this is also responsible for this Indian Institute of Hygiene and Public Health. So this was also got the aid from Rockefeller Foundation, and the Rural Health Training Center, which is started at Calcutta near Singur, it was also got assistance from the Rockefeller Foundation, and Indian Tuberculosis Association was also established in the year 1939. And in the year 1940, the Drug Act was passed. So this was the first time that drugs were brought under the control. So previously they used to use the drugs in different ways, but after this Drug Act was passed, so here all the drugs were brought under the control, and they had this legislation. And actually in the year 1943, the Health Survey and Developmental Committee was placed. So this committee is called as Bhore Committee, which is very important. We will discuss in the coming classes. So mostly you will discuss, you will see this Bhore Committee in the third year. So here, if you see this board committee, it was appointed by the Indian government. So mainly to survey what is the existing health conditions in the India, what is the condition of health organization, and what are your recommendations for the future development. So all the recommendations that we are enjoying now, most of the recommendations came from the board committee. So there are other committees also, but most of them has been came from this board committee. So board committee in the year 1946, they have submitted the report. In which year the Boer committee was established means it was established in the year 1943, and in which year the report was submitted means it was submitted in the year 1946. So in next class, we'll discuss regarding this post-independent era. We'll see what are all the things that were there. So with this, I would like to end the session here. Thank you so much for watching. Please watch for the other session also to see the history. So the history is very broad. Once the history is finished, we'll get into the topic. So the topic will be very nice. Thank you so much for watching. If you like the content, please like, share and subscribe the channel. If you have any type of queries, please drop them in the comment box. Thank you.